So we have Ambreen Sharif, our program advisor. We have Andre Karan, our program head. We have Erin Ruggieri, a marketing coordinator, Darren Todd, another marketing coordinator, and DJ Leiter, the program coordinator for MedLab. So we're all here to answer your questions and present you with information about the medical laboratory science program. So it'll start with Andre giving a presentation and a program overview. Program advising will give a presentation, and that will be with Ambreen. Following that, we'll have a section of time for our Q&A. We're not going to be showing this return to BCIT video. I just noticed that now because it's no longer applicable. We've moved past that phase. Now, for the questions and answers, what we'd like for everyone to do is just feel free to populate the chat. Put any questions you have in the chat, and we will address them at the end. And if you have any feedback, please put it in there as well.
Sorry to interrupt, Julie, but we can't see the PowerPoint.
Oh. No, that's a great interruption. There we go. Everything there now?
Yeah.
Let's just go back a couple. So here's how we started. Here's the statement, the agenda, and in case anybody wanted to see that. And now I pass it over to Andre.
Yeah, thanks, Julie. And welcome, everyone. We appreciate you taking the time to come and learn a little bit more about MedLab and sort of what to expect with our program. So this is a fairly informal process. We're just going to have a couple slides here to show you what the program is, what to expect, and sort of a little bit about the admissions process. So yeah, please feel free to put your questions in the chat, and we'll get to them when we can. So here is our first sort of point that we thought we would have a little bit of fun in terms of doing a bit of a poll. So right now, the image in front of you is an actual lab coat that was designed by our national certification body, the Canadian Society for MedLab Science. It was part of an awareness campaign to bring awareness to the profession, what we do, and sort of the importance of MedLab science in the healthcare setting. So basically what they've done is in tiny microscopic sort of writing, they've put all the tests that MedLab professionals do in a day. So I believe there's a poll question that we're going to come up, and the question is going to ask, how many tests do you think are done in a day? All right, so we do have some numbers. Looks like 1.2, 500,000. So those are kind of our top answers. The actual correct answer is 1.2 million. So next slide, Julie. And I can show you here. The next slide kind of highlights it. So you can see here, zoomed in, this is on the gown. It's all written in fine print, all of the tests. And again, that is true. It's 1.2 million tests are conducted a day here in Canada. What I would ask is, I see there's, if everybody could mute their screen or their speaker or whatever it is, just so that it doesn't disrupt the sounds here. Thank you. So yeah, we can move on. So yeah, thank you for participating in that. Just kind of shows you a little bit about our profession. Just to give you a pretext for this video, this was conducted by Work BC. Again, it was a promotional video to give you an understanding of what it means to be a lab tech in a hospital here.
Our next career plays a vital role in the field of medical science. We're in the lab today to meet a medical lab technologist. Hi.
Hi, I'm Jody.
I'm Brian.
Nice to meet you.
Nice to meet you.
Let's get a lab coat on and get you started.
Great.
My name is Jody Simmons. I'm a medical laboratory technologist, and we're at the Dawson Creek and District Hospital lab. Medical laboratory technologist works in the lab. They run patient samples, blood and body fluids. They're tests that are ordered by a doctor, and we run them on instruments, and we make sure that those results are accurate and precise before we release them to the doctors. A typical day would involve coming in and waking up all our instruments, and then we would have to pull quality control material to make sure that our instruments are running correctly. We would be doing any maintenance, like pulling apart the instrument and cleaning it before we would want to run any patient samples.
What is this machine?
They were looking at the inside of a chemistry analyzer. So when someone, for example, comes in the hospital with a heart attack or a suspected heart attack, this is actually one of the instruments we use to see if there's been damage. So you're always learning about new instruments. Your day is always different. Your day is never the same. You might be learning a new instrument, a new technology. In a small lab like this, we are required to draw blood sometimes, so we'll draw the blood and bring it back to the lab. We're looking at tubes, and I'm going to tell what this person's blood type is by using my reagents and these tubes. So if you're an A pos patient, or if your blood type is O, I'll be able to tell from these tests.
Okay.
You're putting drops in tubes, and you're using pipettes and small equipment, and you're doing maintenance, so it's good to be able to work with your hands. It's good to be very organized, so you can organize your workflow and compartmentalize because you have priority specimens as well. You might get pulled from one thing and there's a stat that comes in and it's a lot more, has priority over a routine sample, and you need to stop what you're doing and work on that stat specimen from the emergency, for example. Always double check your work, because you do not want to make a mistake. This person's bleeding in the merge and they need blood quickly. You need to work quickly but accurately as well. I don't think people realize how closely we work with other healthcare professionals. We work with nurses and doctors quite a bit. So the centrifuge is slowing down. It has spun the two samples together. So basically my patient's cells have just been spun. But if you look here, this is my tube. That there is a blood clot. That's a agglutination of a patient's cells.
So because the blood clumped together within this solution, you know that this is what type of blood?
This is an A person.
Okay.
Because I put A reagent in and the blood clumped, you have an A person. We work shift work, so we have day shifts. Our day shifts start at 7:30 to 4, and then we have a person coming in at 2:30 till 11 o'clock at night, and they're our evening shift, so they're on call all night until the next morning. I was interested in chemistry and biology in high school, and then I went on to get a university degree in biochemistry. There is a degree you can get for medical laboratory technologists, but I have a certification and it's a diploma, so it's a 2.5-year program. The advantage of having a degree over the diploma is you do get paid extra, and you can also take a management position a little easier than that. But the diploma, everybody is certified. You take a certification exam, and everybody is considered certified, and you can work anywhere in Canada. There's always opportunities to further advance your education. You could specialize in another department like microbiology. Also, the CSMLS, which is our certifying body, offers courses online that you can take and further advance. My advice for somebody straight out of school would be to go and do a lab tour, talk to somebody that works in a lab. A good medical laboratory technologist pays attention to detail. They're considerate to others. They really do care about the well-being of people, even though you're not in the forefront and people don't always see you. It's nice to know that you're having an impact on somebody's life.
Jody, thank you so much for showing me around.
Nice meeting you. Don't forget to wash your hands.
You got it. Thanks.
Bye.
Once again, I'm Brian for Career Track, reminding you that this career could be yours. See you next time.
Thanks, Julie. So I just wanted to say, if everybody saw that elbow bump at the end, that was pre-COVID, so I really think we should get credit for that. Anyways, so moving along. So with the MedLab Science program at BCIT, so like I said, we the profession itself does a lot of lab tests every day in Canada. And just to kind of summarize, we use a lot of complex instrumentation to analyze tissue samples, blood, or body fluids. And it's all part of that diagnostic procedure. And then we work alongside other professions as well. Next slide, please. So a little bit about just a high-level overview of the program. So it's a 2.5-year full-time diploma program. It's an in-person program, so you're here on campus with lectures, labs. Everything is delivered here in our labs that we're. I think it'll be in the new building when you come in. So yeah, so you'll be part of the new Health Science Center. So all of the labs are going to be moved to the new building, and a lot of lecture theaters, all that stuff will still be in its current place or even in the new building. So a lot of new things to look forward to. Another part of the program is it's a 35-week clinical placement. And there you're going to get a direct learning experience, hands-on training with trainers and preceptors in the clinical environment. So there's a question, just I know we're going to wait till the end, but there's a question on capacity. So right now the capacity is at 80 students. So there'll be 80 seats. So just a couple facts about the program. So there's a big demand right now for the medical lab profession. If anything, if it's only spiked due to COVID, a lot of the lab technologists were moved from sort of central work into a lot of the COVID testing centers. So again, there's a lot of room right now for extra people. So they're really looking forward to all of our grads. And we work in different areas: hospitals, community and private clinics, such as life labs, blood banks, and research facilities. So lots of opportunities to try different fields. And another kind of interesting note is last spring when the big outbreak was upon us here, the Prime Minister of Canada did a tweet and shout out to the profession, just recognizing the MLT role in effectively managing our response to COVID. So again, that's with all that testing that's been going on. Another thing to kind of keep in mind is for a small group within the healthcare system here, we are actually we're the third largest program in the School of Health Sciences. And then obviously this last point here is we're implementing a new program map. So we've got a lot of changes coming. Just a slight typo, it's actually September 2022. But otherwise, so next intake, which will be the intake you're applying for, will be with a new program map. Great. So what are you going to expect when you come here? So it's a hands-on learning program. So like I said, you'll have lectures with the instructors and the faculty and big lectures, sort of style theaters. And then you'll go off to the labs to perform all the different tests and different experiments, whatever they have set up for you that day. But that's basically the bulk of what you're going to be doing in terms of curriculum delivery. We do have some online courses as well. So when you're going to clinical, there might be some supplementary courses you're going to be taking. So just kind of be aware that there'll be some blended stuff as well, but the majority of it is going to be that hands-on training. And like I said, there is a 35-week clinical experience or clinical placement throughout the province of BC. So we've got clinical seats lined up on the islands. So Vancouver Island, we've got placements. We've got them in the Lower Mainland, and we also have them in the interior. So those three regions is basically where all of our students are going to go and train. And like I mentioned, so all of the lab sessions, they're going to be hands-on. They're going to give a great opportunity to practice in a safe environment with the faculty, with the teachers. So you're going to know exactly what you need to do. You're going to get those opportunities to practice, and then you're going to apply that in the clinical world. So you're going to take what you've learned and practice that on the bench real time with a trainer. So it's a really good way to build those competencies and feel confident when you graduate. Okay, so just a little bit about the clinical practicum. So I touched on it already a little bit, but we've got, so it's a 30-week multidisciplinary placement. So you're going to go through different departments in the hospital, learning different techniques and competencies as you kind of rotate through all the different areas, such as microbiology, chemistry, transfusion, anatomical pathology, etc. So you're just, so you're going to be moving through those departments throughout your time in your clinical. Be mindful that you could be there. So it is shift work, right? So you're working in a hospital, so you could be starting your day shift, your evening shift, sometimes maybe on a weekend or something. But for the most part, we have it all scheduled for you so that it's a convenient schedule. And again, here, there is some responsibilities for every student. So if you are outside of the Lower Mainland or whatever, you will be responsible for your own transportation and accommodations on placements. That's just something to be mindful of. I just want to go back actually one slide to that one, because there's one thing I just want to highlight as well. That's always important, because we get this question a lot, is how do I get to know where I'm going? Well, typically what we do is we have a computerized system called HSPNet, for whatever. But it's a computerized system that basically allows all the students to put in sort of their maybe top choices, and then the computer will randomly assign it to them based on a program. This way, you'll likely get an opportunity to go to one of your spots that you've chosen. So it kind of ranks it and coordinates it with other students. So that's how you're assigned your clinical seat. Yeah, so I'll leave it at that. You can go to the next slide now. Thanks. So for this slide, like I said, job opportunity is great. So there's a high demand right now for the profession, and it's only growing. So there's a lot of retirement replacements, and there's a lot of expansion, particularly up in the north. Here in the Lower Mainland, we're starting to see a lot of new opportunities. I can confidently say too that all of our students who graduate are getting jobs. So that's 100% of them are getting employment. So with this particular one, we kind of threw it in here because we wanted to show, just to kind of give you a little bit more of an insight of what it means to be in the clinical, and sort of at one point you might be the trainer. So in this example, we have one of our former students teaching one of our newest graduates in the chemistry department. So we just kind of want to just show sort of that cycle of, yes, you're going to be here with us. You're going to be learning for 2.5 years. You're going to graduate, get a job, but then you're also going to be a part of that system as well and be that trainer and helping the next group of people. So it's a really nice small community and way to connect with others who are coming up. The other thing I just want to point out too is that with this profession, there's all sorts of other ways that you can, and different career paths you can take. You know, some people work in, like I said, Canadian Blood Services. You can work in research. Oftentimes there's administration or work that you could be doing. You can go into teaching at BCIT. So there's lots of different avenues that you could take with your career in med lab science. The other thing too is tech companies also like to look at med lab techs. Next slide. Okay, so that's it for the program. Like I said, it's a high overview of what we do, and definitely open to answering any questions you have in the chat following my colleague here at Program Advising, Ambreen. So Ambreen.
Hi, everyone. Thanks, Andre. Hi, everyone. My name is Ambreen, and I'm one of the full-time studies advisors at BCIT, part of a group of program advisors who are available at the front end to assist you with any questions you have once you've decided that you want to go with the program. We're a great first go-to place to discuss the entrance requirements and the admissions process. So I welcome you to contact us with any specific questions that you have. I'm just going to go through the some of the entrance requirements. Julie, if you want to skip to, yeah. So I noticed that this has already been posted on the chat. We had a question about the entrance requirements. So the high school entrance requirements are English 12 with a 73, which is like a B. Pre-calc 12, biology 12, or anatomy and physiology as it's called, chemistry 12, and physics 11. And the physics 11 is 67%. So those are minimum entrance requirements, bearing in mind that this program does follow a competitive entry process. So we encourage you to put your best grades forward for the program, because there is a sort of a selection process that's part of the admissions process for the program. So the higher your grades, the better your chances of being admitted to the program. There's also sort of a preference, or like program likes to see any additional education you might have. So if you have any additional post-secondary studies that you can show that you've done well in, as well as recency in some of those entrance requirements. A 5-year recency is preferred but not required. The other requirement now is a CASPER test. This is a soft skills test that's done through the CASPER organization, and it's basically testing your ability to be able to respond in different situations. So more of your emotional intelligence and your ability to make discerning decisions. So that's a test that's sort of scheduled depending on the intake that you're looking at. You'll have different tests that you can register for. And that will be one of the entrance requirements that you will submit with the academic requirements. So that's step one of the admissions process. Go through that step, that goes to admissions, and we'll talk about how to apply in a second. I'll get to that in a couple of slides. But that's sort of the first stage. And then if you're selected through that stage, it goes to the program area, and you're invited for a multiple mini interview. And that's sort of a panel of interviewees, and again, assessing your academic history, your communication skills, number of different factors through that interview process, your knowledge of the profession and passion for healthcare. So that's something you can sort of prep for prior to an application as well. And then step 3 is a criminal record check and immunization review that's submitted as well. Julie, next slide. Okay, so we had a question about start date. So it is currently showing a January and a September intake, and that's because the program generally now has a September intake, but the September 2021 intake was postponed due to COVID. So we now are showing that January intake, which is causing a little bit of confusion. But generally speaking, this program has a September intake each year. And we accept applications from October 1st of the previous year until May 1st. So you can submit an early application after October 1st if you're still working on your requirements or doing some upgrading. But we encourage you to get everything in before that deadline date of May 1st, because that's when the program area starts to look at the application and you go through that competitive selection process. So May 1st is the final deadline. You can apply early and then upload additional documents, but you have to let admissions know that you've done that. So some additional qualities the program is looking for, just to list a few: curiosity, being process-oriented, being accurate, being self-sufficient, and fascinated with science. Andre? Maybe you can speak to that a little bit more after. Okay, Julie, next slide. Okay, the application process. So for BCIT, we do everything online now. Your entire application will be submitted online. So the first step would be to review the entrance requirements. If you go to bcit.ca, do a search for medical laboratory science, you'll pull up the program. You can open up the program webpage, click on program entry. On the left-hand side, there's a list, and you'll see the entrance requirements that we've just talked about. And if you require any upgrading, if you'd like to discuss what you've done previously, whether that's in high school or any post-secondary studies that you're wondering if those courses will meet the entrance requirements, that's where you can come to program advising for assistance with that. And we can walk you through some of that. We can also assist you with your upgrading options to meet those entrance requirements. So anyway, step 3 would be to collect all your documents. So we're looking for official transcripts that have been scanned and attached as PDF files with your online application when you apply online. So on the program webpage, under program entry, you scroll down under the entrance requirements, there's an apply now blue link. Click on that blue link, that's the online application. Follow the prompts, attach your documents as PDF files with that online application prior to that May 1st deadline. And then after that date, the program will collect all the qualified applicants, the ones who meet the academic requirements, and shortlist, and then do the multiple mini interviews and select the 80 applicants for that intake. This process, it says the process can take 4 to 6 weeks. That's probably for the initial reviewing of the academic requirements. If you're wondering where you'll be corresponding with admissions, that will be through your My BCIT. So once you've submitted an online application, on the top of the program website is a My BCIT link. You'll have a student number and access to email, BCIT email, and you'll be receiving updates from the admissions office through that email account. Okay, Julie, next slide. So at BCIT, we are approaching your studies in more of a holistic way. We have a student life office now that assists students throughout their study cycle at BCIT. We're not just viewing your studies or your education from the perspective of your academic success, but also looking at other areas, you know, where you might need support or where you might be able to grow. So Julie, if you want to skip to the next one, I think it's more specific. Oh, I don't think it goes into it, but anyway, the student life office is you know, relatively new, and then there's a student association as well. Lots of services and supports for students throughout your studies, especially given the current climate and transitioning back to school post-COVID, or even with your online studies. For instance, we have a counseling services that students can access for free. Full-time students can access that. Our financial aid office has financial aid officers that you can make an appointment with. Just to give you a couple of examples, and also our students all have access to fitness facilities such as gym and other services as well. So in terms of contacting program advising, my department, for any questions that you have, Julie, do you want to just go back one slide? We are available in a number of different ways, and this will continue to change as we transition back to life on campus. But for now, you can reach us. We have a live telephone advising service throughout the week from Monday to Friday. On Mondays and Fridays, it's from 10 a.m. to 12 p.m. and Tuesday, Wednesday, Thursday from 1 p.m. to 3:30 p.m. So you can call us and be put through to either myself or one of my colleagues directly. You can send an email as well, program_advising@bcit.ca, with any specific questions you have, or to request a one-on-one Zoom appointment. Those are great because we're able to clear up a lot of your questions directly through a Zoom appointment. So feel free to contact us, and we encourage you to do that, especially with a program that's competitive, because we can go into a little bit more detail about your academic background and give you some help with the application. I think that's it, right, Julie? Next slide, take a look at it. I think it's just some social media links on the next slide. Julie?
Yeah, sorry, I'm flipping through.
Okay, yeah. So we've got our Facebook link there, a couple of different portals to learn more about BCIT. We have information sessions like this one, but also a big info night. Everything's been online, obviously, through this time, and continue to check our website for updates on that. Yeah. Keep going, Julie, next slide. And now we're into our question and answers. So I'll just hand it back over to the faculty and to Julie, and I look forward to speaking one-on-one with any of you that are interested in contacting us. Thank you.
Okay, I'm going to read out some of the questions. It looks like a lot of them were answered in the chat. So if I miss anything, if I could ask my colleagues to just jump in. But the most recent one that wasn't answered is there a preference for BC residents? Andre?
No.
Fair enough. So that means that anyone across Canada can apply equally?
I guess I could expand on that. Anybody can apply to the program.
Okay. And is application open now for September 2022?
Applications will open in October for September 2022.
Thanks, DJ. Is work experience in healthcare preferred?
So short answer is no. In terms of like your application, it won't affect your application status in any way. It can be helpful if, you know, for you to gain knowledge in that industry and stuff like that. It's never a bad thing, but it won't affect you whether you get into the program or not, whether you get accepted into the program or not.
Are students eligible for student loans during the clinical placement?
Yes, and I'm not too familiar with it, but apparently there's some actually pretty good bursaries and some financial aid that's available. So definitely, I did put a link for the financial aid and also financial FinAid and awards in the chat. So definitely visit those websites and contact financial aid at BCIT.
What's the difference between the September intake and the January intake?
I can answer that. Well, sorry, it's background noise. So just exactly like it sounds. So the intake will start in September and one will start in January. So we normally start in January, and up until this coming January, this is going to be our last January intake. And starting September 2022, we will be moving into a September intake. There will no longer be a January intake. So every time you apply in October, those applications will be for the following September.
How many seats are available?
80 seats.
And oh, okay, looks like we answered all the questions. Let's see if there's any.
So how heavily is Casper weighted? So we don't really get into specifics about how we weight, but it is important. So your GPA is important, your Casper score is important. It is important. And keep in mind, I don't know if any of you have done the Casper assessment before. It's an assessment, so don't be worried about passing or failing. Like, you do have to do well, and it is important that you do well. But one thing I've been told is, like, you don't have to worry about like your English grammar and stuff like that. I think that kind of bumps people, that they're so worried about your English. We're already assessing your English by checking your English grades. So the Casper assessment doesn't test your English, it tests your soft skills.
Mhm.
We just have some comments in the chat, but not really any questions. If anybody has any actual questions, we'll give it another couple minutes. Oh, here, do I need 3 referrals for the application? I'm assuming 1 link.
No, you don't need any referrals. There's no referrals required for the application process. Or at any process, at any point.
Okay. And does the program make allowances for special needs?
Yep, we do. So once you've applied to the program and you've been accepted as a student, BCIT, so to what Embreen was saying earlier, we have a host of different services at BCIT to support every learner here. So basically, once you're accepted into the program and you can access any of those services, and what they would do is set up the right plan for you. But really, it just depends. It's on a case-by-case basis and depends on what the person actually needs to be successful.
Just to add to that, Andre, there's an accessibility services department at BCIT. So you would contact them, and you can do that even in advance to discuss their supports. And basically, they would liaise on your behalf with the program area to design a program that would work for you and based on your needs and assessment. Yeah.
Okay, we have a couple more questions. Have the MMI invites been sent out?
So for people that have already applied to the program, yeah, that communication will be sent to you privately.
And when are the clinical placements distributed when students have received admission?
Okay, so normally they were done within the first month of when you start the program. So normally they would have been done in January, which is probably what we'll be doing again next year. So within the first month.
Mm-hmm. Yeah, so just remember, we're switching over to a new program structure. So traditionally we would have done it, yeah, like DJ said, between January, February, March, something within that range. Now that we're moving to a fall term, it'll probably align with a similar process. So probably till fall of 2022, you would have that information.
Okay, and this question was about undergrad. I'm just going to read it out loud, sorry. I have a bachelor's in biochemistry and have all the math, chemistry, and other requirements filled at post-secondary levels. Does a B- average for high school graduate still apply? So I'm going to try to answer this. So our requirements for the program are listed on the program page. So there's 73% minimum requirements for most of the classes. However, most of the applicants that are being accepted, they usually have a higher than 73%. I do encourage you to apply if you do have the minimum requirements. However, the last intake, I know we did accept students that had applicants that had a higher than 73% minimum grade. So what we do is we look at your higher grade. So if you did higher in high school, then please use your high school transcripts, even if it was 10, 15 years ago, use your high school grades. If you did better in post-secondary, then please submit your post-secondary transcript. You don't need to submit both. You can submit both, but we only, admissions only enters your higher grade, and that's what we review. I hope that answers your question, Victoria.
Can I add to that, please? So I just wanted to add that when admissions looks at the post-secondary transcript, if you decide to submit that, they would be looking for the same grade. So if the requirement is, say, for pre-calculus 12, and you're trying to use a post-secondary calculus course to meet the requirement, they would still require a 73% to sort of get your application through to the department. So that's the minimum criteria that they will use to push your application forward to the department to look at it. So if you're using a higher level course, basically you need the same minimum grade, regardless. Yeah.
Oh, and I'm going to mention one thing just because I do get emails about this. So when we look at GPA, we don't look at your overall GPA. We look at your entrance requirements. So it'll be the physics, chemistry, biology, etc. We do a GPA of those grades. So if you happen to do not so well in a psychology class that you used and is not even used in your entrance requirements, don't worry about it. We're not going to be even looking at those grades. The only grades that we take into account for your GPA is from your entrance requirements.
Thanks, DJ. Okay, and with that, I think that we can come to a close. I'm just going to put up the MedLab email address. I'd like to thank everyone for attending this session, and Andre, Ambreen, DJ, Aaron and Darren, and myself for presenting and hosting this. We like to do these to reach people that want to know more about the program. And so we invite you to email us if you have any questions or feedback about this. And we look forward to hearing from you. Thanks everyone, and have a great day.